Hi guys, in this video I want to show you the different materials which are available when you're rebuilding your smile after having an all-on-4 treatment. Now, for those of you who are unsure or you've never heard of all-on-4 treatment, it's a treatment when you've had all your teeth removed, we've got 4 to 6 implants in position, and we then rebuild a full set of teeth on those implants. So there's a couple of different materials which are available. They differ in cost and there are other differences as well. And I personally use three materials. There is a fourth one which I don't have too much experience in, and that's a full zirconia bridge. So zirconia is a very hard material, and a full zirconia bridge basically connects all of the implants together with this hard material, and then it's layered with pink and the different shadings of the tooth material on top as well. I tend not to use it just because I don't use it. Every dentist has their own favorite kind of material, and it may be that the dentist who you're seeing loves zirconia. I mean, I've seen some amazing results with zirconia, as with any of these options available. So let's go for the most cost-effective solution first, which is just having a full set of teeth made from plastic and made from denture teeth. Now, a full set of teeth made from effectively denture material fitting on implants will cost about £3,500. So it's rare that I actually use this solution because of its strength. It's not that strong. Because it's made from plastic, and with implants you're able to put a lot of biting force on the teeth, it's much more likely that plastic teeth are going to break. However, saying this, I've seen patients who have had plastic teeth for 10, 15, 20 years and they've just worn down, but otherwise they're okay. So I don't want you to think that if you have plastic teeth, they're absolutely rubbish and they're going to break. They may last you a long time. Now, the disadvantage of plastic is that in order to gain strength, you need to have thickness. So when you have all of your 4 implants, or however many implants it is, the thickness of the final teeth is going to be much thicker if we have a plastic solution. The next option, and this is probably the most common one that I use, is to have a metal framework made and then have what we call an acrylic wrap. So the same denture materials, the same denture gums and the denture teeth on top, but underneath is a metal skeleton. So here's what the metal skeleton looks like, and this is a computer designed skeleton, and it's what we call 3D milled. So there's special machines which make this out of a block of metal to fit on your implants exactly. This metal gives the whole thing a lot of strength, which allows the teeth to become a lot thinner. And in your mouth, because your mouth is so sensitive, this difference in thickness is going to be really obvious. So the metal framework allows it to be thinner, but also it allows you to have one extra tooth. I only put one extra tooth behind the final implant. Because this tooth is unsupported, in acrylic it's going to be too weak, it's just going to keep breaking off. But with a metal framework, you're able to have this extra tooth on the back of the final implant, which in a lot of cases is quite it's quite a nice thing to have, because if you smile really widely you can often see that far back. So in terms of cost, this bridge is about £5,000, and if we're doing an all-on-4 treatment which say costs £15,000, that's included in that cost. That's the kind of the standard one that I use. There is another option which again looks really nice, and this is to have individual porcelain crowns made you use the same metal framework, but on the framework, instead of using denture teeth, which are kind of standardized teeth, you can still add variation and customize them so you get a really nice smile, but the porcelain ones are all individual and they do look a little bit nicer. But there are pros and cons to having this done as well. So in terms of cost, these cost an additional £5,000. So if we're doing an all-on-4 with porcelain, it's going to push the total cost to nearly £20,000. Okay, so it's only for the really serious people who want to have the ultimate in aesthetics. The downside to having this kind of thing done is that porcelain has got no shock absorbing properties, whereas the acrylic is a softer material. When you're chewing, all the biting forces with porcelain are transferred all the way to the implants, and that's why it's not really recommended to have porcelain top and bottom. So if you were having your top and bottom teeth done, then and you wanted the best aesthetics, I would say, look, have porcelain at the top and then have the acrylic wrap at the bottom. In terms of aesthetics, it doesn't actually matter which material you go for. What is way more important is the lab that's being used and how artistic is the lab technician, because some people get aesthetics and other people are just like a factory, just churning out teeth, and that's when teeth don't look that great and they're not as customizable as possible. So I've tried a whole bunch of dental labs in the UK, and there's only one or two that I would actually trust in these high demanding cases where aesthetics is really important. And even the acrylic wrap on the metal framework can be made to look so nice and really natural, and that's the main reason that that's my preferred solution, and it's pretty rare that we go for the porcelain solution. So a lot of people get hung up on the details of the different materials available for the final bridge work. Really, when I'm doing this treatment for my patients, it's the thickness of the teeth which matters a lot, not so much the minute detail between the porcelain and the acrylics, but it's the overall appearance of the smile and how natural the teeth look. And you can get amazing aesthetics just using high quality denture teeth and having an artist technician who understands aesthetics and can make gums look really natural. So I hope you got something out of this video. Please give it a thumbs up and comment. It just helps other people find it as well, and remember to subscribe. So take care, bye.